Good afternoon, Dr. Soloway speaking. It's midday on Thursday, and I wanted to catch up on some housekeeping with my friendly and loyal followers. First, Dr. Monero, great suggestion to call this Dr. Steve TV. I like that very much. Second, Eduardo, my favorite medical student from Argentina. Thank you for friending on Facebook. Hopefully, you will like the practice, and obviously, you are a follower on our growing list of 1,200 or so subscribers to this YouTube channel or TV station, as we may call it from now on. I've had requests to let my goatee grow in. I have mixed feelings. So today, being a mellow day, we're going to talk about a couple of bloopers that I've had in the past, and there's two that come to mind. I had a lady 10 years ago arrive at the practice. She had been getting Remicade for 5 years in another country for supposed ankylosing spondylitis. She came with her husband, and she brought all of her lab data and testing from the other country. And I said I'd be happy to give you the drug. I just need some proof of your diagnosis. She handed me a bone scan and said, look, I have bilateral sacroiliitis and I've been getting treated for this for quite some time. And I feel good, but sometimes I don't feel good. She seemed a little bit down in the dumps, but nonetheless, she gave me her bone scan. This is after I took a history and physical from this patient. When I looked at the bone scan, the first thing I noticed is that it was normal, and I pointed out to the patient that where the uptake was, where she thought were the sacroiliac joints, were in fact the kidneys. Well, she had me so convinced that I really thought I was losing my mind. So I promptly sent this to two of the attendings that had trained me, and they both reassured me I wasn't crazy and that the bone scan was normal. So now I had to explain to a woman from another country that not only is she not getting Remicade, but she never needed it for the preceding 5 years. Long story short, the physician that was prescribing the Remicade for her in this foreign country was getting kickbacks and was doing bone scans on everybody, telling everybody that their kidneys were their sacroiliac joints, and so on. I think you get the picture. So that doctor is in prison. The patient that I'm treating is on Zoloft, and everything was happily ever after in this case. Another case comes out of either Cape May or Atlantic County a few years back. I think you'll find this interesting. Patient was referred to me for a positive rheumatoid factor. And the first question I typically ask when somebody is referred to me for an abnormal test, I ask them, why did your doctor order the test? And the patient responded by stating, I had the rheumatoid factor drawn because I have breast cancer. So, this didn't make a lot of sense to me, but the patient did in fact have a positive rheumatoid factor. So after I took a history, I found out a couple of things. One, when I asked the patient what type of breast cancer that she had, I was trying to find out whether it was estrogen receptor, progesterone receptor, or HER2 positive or negative, and was the patient taking an aromatase inhibitor? Was the patient taking the other drug that's only for estrogen receptor positive, I think tamoxifen? Anyway, patient says, I never had a breast biopsy. So now I'm a little more confused. You had breast cancer without a breast biopsy. You got a rheumatoid factor done because you had breast cancer. So if you're confused, trust me, it's appropriate because I'm confused too at this point. So I go through my rheumatologic review of systems, and in fact the patient did say, yes, I have dry eyes and dry mouth. So I'll give you 3 seconds to think. Do, 3, 2, 1. Okay. So what transpired next, and after looking into the case, getting records, It turns out that this patient actually had lymphoma. The patient had Sjogren's syndrome with lymphoma, with dry eyes, dry mouth, not only a positive rheumatoid factor, but a positive ANA, SSA, and SSB. And this was all found out at this office by me after the patient had undergone chemotherapy for breast cancer. Unfortunately, this patient did not have a good course and perished several years later. This is the other blooper that I can think of for today. So if there's any suggestions, comments, complaints, topics, please let me know. Now I have tried to touch on vasculitis, particularly small vessel we did the other night. We did a case of progressive systemic sclerosis or scleroderma the other night. We've hit relapsing polychondritis. We've made a couple of comments on sarcoidosis. I believe we may have touched on IgG4-related disease. Haven't really focused much on myositis, rheumatoid arthritis, osteoarthritis to my recollection. However, please don't forget that I have some lectures from about 5 years ago on lupus, gout, psoriatic arthritis, and several other topics that have been viewed hundreds of thousands of times over now worldwide. And I think this information is valuable to students of all disciples, patients of all illnesses, other clinicians not in this field, and I believe I can be an excellent resource if you're studying for your boards or if you simply have questions. So we offer boutique care set in a boutique setting with university quality, second to none, and I emphasize second to none. Again, have a great day. Thanks for listening, and I look forward to seeing you soon.